So hi everyone, good day. My name is Francis Jasmine Swanner Yap, your second year student nurse from Davao Doctors College. And today I am going to perform the perineal flushing. So perineal care involves the washing of the genital and rectal areas of the body. So this prevents the irritation, odors, and infection. So now let's prepare the necessary equipment such as the basin. So assuming that this is a bedpan, a pitcher with the warm water, the two forceps, the working and picking forceps, and of course the draw sheet, the kidney basin, the clean gloves, the perineal pad, the 7 dry cotton balls, and of course the another 7 cotton balls soaked in antiseptic solution. So this helps us to save time and energy. So do not forget to perform hand washing to prevent the spread of the microorganisms. So now, after preparing the necessary equipment, let's explain the procedure and treatment to the client on how she can participate. Provide the client the opportunity to ask for her concerns, and of course, establish a good rapport to the client so that she won't feel uncomfortable during the assessment. And of course, ask how the client and how she would like to be called. So ensure the client's comfort and privacy. So hello ma'am, my name is Franz, your attending nurse for today. So may I know your name?
I'm Mary.
When is your birthday?
November 27.
Okay, so is that okay that I'm going to check for your wristband?
Yes, you may.
Okay. So what do you want me to call you?
Anything you want?
Okay, so Mary, the procedure that I will be doing is that I'm going to perform the perineal care to you. This is to remove the normal perineal secretions, odor, and of course to prevent some infections and contaminations of your genitals. So I will be touching some parts of your body, especially to your genitals. So is that okay with you?
Yes.
Do you have any clarifications or concerns?
None so far.
Okay, so as you can see, I've closed the curtain so that there will be no other people who can see us, and of course, to respect your privacy.
Okay.
In a bit, we are going to start the procedure.
Okay.
Ensure to screen the patient and lock the patient's room to provide the patient's privacy. So now, cover her body and legs with a bath blanket. Position is at the corner of her head, and the other corner is at her feet, and the other corner is at her side. So now, position the patient into a dorsal recumbent with her knees flexed, and put the patient on a bedpan. So this is to prevent the bed from becoming soiled. So ma'am, I'm going to position your legs into a dorsal recumbent. So now, drape the patient, exposing only the area to be cleansed. So minimum exposure lessen the embarrassment and of course, to provide warmth. So now, let's inspect the perineum and flush the perineal area with warm water. So note for any particular inflammation, swelling, excessive discharge, or secretions from the orifice. And of course, presence of odor. So warm water is used to prevent the chilling and dissolve the blood clots. So now get a cotton ball soaked in a cleansing solution using a pickup forceps to maintain the sterility. So now, cleanse the external genitalia starting from the midline of symphysis pubis down to the anus. Don't forget to never retrace a stroke to prevent the contamination of the area. So now, with a second cotton ball, cleanse starting from the mons pubis in a figure of 7 by way of external labium towards the anus, then discard. So secretions that tend to collect around the labia minora facilitates bacterial growth. Now, do likewise on the opposite side by the next cotton ball. So now with the fourth cotton ball, cleanse starting from the mons pubis in figure of 7 by way of external labium towards the anus, then discard. So now, do likewise on the opposite side with the next cotton ball. So with another cotton ball, cleanse groin, starting from the groin, going to the thigh, up the thigh. Use other side of the same cotton ball for near groin. Then do likewise. So now let's flush the perineum thoroughly with the sterile warm water. So now, using the 7 dry cotton ball, dries the perineum with the same stroke as above. So moisture supports the growth of the many microorganisms. Now, let's remove the bedpan gently and turn the patient to side. So if necessary, takes one cotton ball and cleans one side of the buttocks. Then clean the other side of the buttocks and dry both buttocks to provide the comfort. So now, let's turn the patient on her back and make her comfortable. So spray with antiseptic as needed. So now, this is to promote healing. So put the perineal pad with a up-down motion as needed to prevent the contamination of vagina and urethral from the anal area. So now, does the aftercare of the materials used, and don't forget to do hand washing. So now let's record the treatment done to the patient and discharges observed. For the documentation purposes, that the procedure was done and means of communication.